Hi, my name is Trayvon Walton. On behalf of Ole Miss SNPhA, thank you for reviewing our prescription to service proposal. Our project is built in partnership with the G.A. Carmichael Family Health Center, a multi site FQHC serving underserved communities across Mississippi, and guided by Dr. Brown, an ambulatory care pharmacist who has been a mentor to our team. Mississippi ranks among the lowest states for adult health literacy, and Canton, Mississippi reflects this reality every day. Patients often struggle with understanding their medications, device technique, or knowing what to do when their blood pressure or glucose readings are above goal. Care Made Clear was created to close this gap through simple, visual, literacy friendly tools designed for Canton residents.
Hi, my name is Jada Buchanan, and the problem is clear. According to Barbara Bush Foundation for Literacy, 28% of Mississippi adults read at below basic level, and zero counties reach proficient health literacy. Patients in Canton, Mississippi often rely on heavily verbal teaching, which often leave the clinic without any type of resources they need to succeed in their medication routine at home. This also affects their ability to manage chronic conditions like diabetes, hypertension, and high cholesterol, and creates preventable barriers in everyday care.
Hi, I'm Sydney, and our solution is Care Made Clear, a literacy responsive toolkit designed and delivered by PharmD MPH dual degree student pharmacists. Every patient that walks into the federally qualified health clinic, GA Carmichael, in Canton, will walk out with visual materials written at a second to third grade reading level, hands on device practice for blood pressure cuffs, glucose meters, and inhalers, and simplified daily medication routines. As there is a large Spanish speaking population in this location, we will also create bilingual binders specific for that patient population as well. Lastly, we'll provide large print refill guides and transportation resources for Canton, Mississippi, because not only literacy plays a role in health outcomes, but so does transportation barriers.
This becomes their daily home reference, keeping health information simple, visual, and practical for real life, including their disease states, explanations without medical jargon, and visuals. A master binder with common disease states will remain at the Cancer Clinic for long term use, ensuring sustainability and support for patients well after our project ends.
Our team structure ensures consistent follow up and a strong presence at the clinic. Two of us will be based in Oxford, Mississippi, and focus on creating materials, data evaluation, and post clinic phone check ins to ensure our implementation efficiency. Our Jackson based student will support workflow in Canton and provide immediate patient teaching. Together, we will be able to site on weekly throughout May and June, and our structure allows us to support patients before, during, and after appointments.
We'll also measure understanding before the visit and again 2 to 3 weeks later. Our primary outcome goal is a 20% improvement in patients' chronic disease understanding in at least 60% of patients. We'll also track device use accuracy, home routine confidence, refill security, and barrier reduction. All assessments are plain language and anonymous.
And now for our budget. Our 2500 budget supports laminated binders, visual steps surrounding patient specific conditions, device training supplies, and patient incentives for follow up, including pill organizers, writing tools, many hygiene items, and clinic transportation resources. Because GA Carmichael is a health system throughout Mississippi, the full toolkit includes common disease state guides, binders, device support, and incentives for patients remaining at GA Carmichael locations throughout Mississippi for continued use, extending the impact beyond our project window. Care Made Clear builds understanding where has been missing in Mississippi for too long.
It gives patients the tools and confidence to manage their health every day at home.
And it reflects SNPhA's mission to serve the underserved through student led change.
Thank you for considering our project. We are ready to make care clear.